This video is meant to demonstrate how a thick-skinned patient can be helped tremendously by the use of Fluorouracil and steroid injections in the immediate postoperative period. In all patients, the first visit is about cleaning out the nose so breathing can be restored, as well as removing the tape and casting that's been on the nose typically for 7 days after surgery. The tightness of the taping and casting can keep swelling at bay so patients can see the shape of their new nose before new onset swelling sets in after its removal.
Oh my god!
That's
Crazy.
what we should do.
New Year, new me, taking a new
Patients can very quickly forget what they looked like just a week before, so it's always useful to show them the images that were taken preoperatively. 2 millimeters higher than it's going to be. Same thing with the tip. Everything proportionally is what it is, but it's all going to deproject and settle back.
Okay.
Right? This cast is trimmed down. People wear that at night for the next month with a little piece of tape across it. Steroid to take down the swelling and the chemotherapy agent to reduce any early scar tissue in the nose that might be contributing to any fullness. It tends to be more of an issue in thicker skin. So I figured I'd give you a second, just show you a couple of their photos so you can see how awesome it really is.
No one noticed. I was at church with people I've known my whole entire life. No, I think only one person out of like everyone actually noticed, which is surprising.
Proportional. So it winds up not being that nose. And then even the front, though you're swollen, I'll show you that. Is
Yeah,
right?
definitely.
Yeah. So you're just missing some of the contouring. That's what we're going to do with the shots.
Great.
That's what the FU is for.
Do I still need to wear the cast and stuff? Okay.
You are
What
free
about
of.
glasses?
You can do anything you want.
Okay.
Feel your nose. There's like nothing here, right? Here you feel something hard, but here there's like nothing.
Yeah.
That's what I'm getting rid of. The nothing.
The steroid can be helpful in reducing swelling, which is more relevant in the early stages after surgery.
Totally not.
The Fluorouracil is an agent that inhibits actively producing cells. In a post-op patient, those cells are producing scar. Especially in a thick-skinned patient, more scar tissue is going to be present than most, and the Fluorouracil can be invaluable in keeping that at bay.
All right, so within a couple days you should start to see some improvement. See how everything is. So there's your right side with a nice and smooth septum. And here's your left side with a nice and smooth septum. They look pretty even. Are you like an allergic person?
Yeah.
It looks like your nose is trying to be allergic, but it can't. Meaning like your turbinate is trying to swell up and there's a bunch of mucus that generally reflects allergy. But your breathing's good still, right?
Yes. My breathing has increased immensely. Like the quality of my breathing, I should say. There's no more like whistling in my breathing. I'm able to like sleep with my mouth closed. It's very pleasing.
So I love this. So let me look at your 3/4. Okay. So I think the Fluorouracil was very helpful in terms of contouring your nose because with thicker skin, usually at 3 months, you don't have this much shape. But I do feel like there's a little bit more contouring that we can get. I can't inject right on the top of the bridge, but I can inject off the sides. I think one of the areas that's sometimes a problem is when you inject just here, then that area kind of thins out and the area above it doesn't. And so it creates the appearance of a bump sometimes because that area is still going through the natural healing process. But you can't inject right here because it's too sensitive an area. You can get contour irregularities, but you can be off-center and it's fine. So we just do a little bit in the right side. Then you have this little area of fullness right here. I don't know what that is, but I'm going to see if I can knock that out. And then we'll do a little bit up there. Oftentimes that'll help with the 3/4 issue.
Thank you.
Yeah.